Professor Philip Chu, Group Chief Executive Officer, National Healthcare Group, Professor Eugene So, Chief Executive Officer, Tan Tock Seng Hospital and Central Health, distinguished guests, speakers, judges, members of Care Connect Volunteer Committee, patients, caregivers, community partners, volunteer friends, and healthcare colleagues, a very good morning. It gives me great pleasure to welcome all of you to the 5th Singapore Patient Conference. We are privileged to have with us the presence of Mr. Ng Hao Yu, Permanent Secretary, Ministry of Law, and Second Permanent Secretary, Ministry of Health, and our special guest to join us for this 5th installment of the Patient Conference. It is wonderful to see many familiar faces among us, and we thank you for your continued support towards this meaningful platform where we learn, co-create, and co-design care together. On behalf of the organizing committee, I would like to thank all our Singapore Patient Action Award judges, guests, and friends for making time in your busy schedules to join us today. For the Singapore Patient Action Awards ceremony today, we are privileged to have a distinguished panel of judges from the healthcare and community sectors, including Ms. Teo Sing Woon, Deputy Secretary for Development, Ministry of Health, Dr. Wong Lung Man, Principal Consultant and Chief of Care Transition Division, Agency for Integrated Care, Ms. Anita Pham, Board Member of the National Healthcare Group, Professor Chin Jin Ji, Deputy Chairman, Medical Board, and Divisional Chairman of Integrative and Community Care, Tan Tock Seng Hospital, and last but not least, Ms. Pauline Tan, Chief Executive Officer, Yishun Community Hospital. A special note of appreciation goes out to the extremely talented A Cappella Society for starting the conference on an uplifting note and with their melodious tunes sung in such perfect harmony. I think it's a bit too short. We could have made it longer. Thank you for introducing us to this wonderful world of cappella and vocal music. This year's theme on volunteerism has struck a chord in my heart. Being a volunteer at Tan Tock Seng and other healthcare institutions for more than 10 years has given me the opportunity not only to learn new skills, but also to teach others. Indeed, there's a whole range of skills you can learn and gain and improve while volunteering. I have personally witnessed how volunteering can make an unbelievable difference to people's lives, and this has been a great discovery for me over the past decade. Being part of the extended network of 27 volunteer groups and patient support groups here at Tan Tock Seng Hospital, we have the greatest privilege of learning from passionate individuals who have inspired us with their courage, empathy, and generosity of spirit, quite often in the face of adversity. I'm also very pleased to share that we are paying tribute to 13 extraordinary individuals and groups at the third year of the Singapore Patient Action Awards ceremony today. We have invited two of the award recipients, patient advocate Ms. Irene Lim, where are you, Irene? And patient engagement team, Singapore National Stroke Association, to share with us their inspiring stories later on today. Thank you.
Thanks, Elaine. Through the theme for this year's Patients Conference, Volunteerism, Powering Change in Health and Social Care, we hope to create a deeper appreciation of the positive impact of volunteerism and how it has successfully bridged health and social care. Volunteers and caregivers can play an important role to enable us to focus on health and shift care beyond hospitals into our community. Together with our healthcare professionals, they are a key part of our strategy to enable better health and social integration. This year, we have the privilege of inviting our guest of honor, Mr. Ng, to witness the launch of a new training and research institute, the Center of Health Activation, or CHA, or CHA for in short. Okay, I know there are quite a lot of CHA jokes amongst ourselves. But you hear a lot more of it later on. So CHA aims to empower people by providing them with the opportunities, skills, and resources to serve in the health and social care realms. It seeks to unlock community and individual resources for action on health. In training, CHA will develop an integrated suite of high-quality training programs to fill the workforce gaps and meet evolving healthcare needs. To kick things off, CHA will consolidate our hospital's existing volunteer and community engagement programs and related hospital improvement projects. To allow volunteers to try different programs as their experiences, skills, and interests may evolve over time. This will also provide a common platform for volunteers to meet regularly and share their ideas. These programs will be offered by CHA in the community and in the upcoming Ng Teng Fong Center for Healthcare Innovation when it's ready in late 2018. CHA is part of how we can innovate and integrate health and social care. In research, CHA will harness the voices of patients, families, volunteers, and healthcare professionals to identify needs within the community to develop better programs and training aligned with each volunteer's personal interests. No volunteer is the same, and CHA aims to understand and focus on the strengths of each individual volunteer to achieve better outcomes for our patients and for ourselves. We hope that the newly acquired skills and passion and contribution of every volunteer will drive the next phase of development towards a socially inclusive, caring, compassionate, and empowering healthcare landscape. The 5th Annual Singapore Patient Conference has grown significantly in size and scale as we continue our outreach journey into the community. We are very thankful to our healthcare and community partners and many organizations who readily supported the outreach efforts of SPC in the community event. Together with our community and healthcare partners, Whampoa Community Club and Tan Tock Seng Hospital's Department of Palliative Care, we co-organized our inaugural charity walk on the 30th September in support of the World Hospice and Palliative Care Day. Flagged off by Mr. Heng Chee Hao, Senior Minister of State and Member of Parliament for Jalan Besar GRC. We clocked a total of 200 kilometers in support of the Walk for PAL Challenge. The walk ended off with an interactive and fun-filled health carnival at Whampoa Community Club. More than 400 patients, caregivers, and volunteers in Central Singapore participated in educational talks, health screenings, community exhibitions, and mass exercise demonstrations. Are there any of you all who attended the SPC in the community the other day? I'm sure there are quite a few. We have also prepared an exciting lineup of inspirational speakers from all walks of life and fringe event activities today, exemplifying what it really means for everyone to play an active role in healthcare and to give back to the community. Through the meaningful dialogues, stories, videos shared today, we hope that many of you will be inspired to pay it forward and do your part for healthcare. In the words of famed cultural anthropologist Margaret Mead, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only way that ever has. We wish you a most enjoyable conference ahead. Before we invite our guest of honor, Mr. Ng Hao Yue, on stage to give his opening address, we would like to play a video short showcasing the highlights of our community outreach in Central Singapore over the past 3 weeks. So a big thank you to our activated patients, families, and volunteers who have joined us on the purposeful journey of powering change in health and social care. Thank you.
Thank you.